swollen eye, bloodshot eye, runny nose, toothache, earache, pain that migrates from the back of my neck up around, feels like I have a pickaxe above my left eye.
45 million Americans suffer from chronic headaches, and of those, 23 million Americans suffer from severe migraine headaches. It really doesn't matter, you know, when you break down the different types of headaches, from a cluster headache to a tension headache to migraine headache. Really, you know, most treatments are directed towards treating the symptom, whereas what we do in our office is actually look for the cause of the headache or of the malfunction in the body, even if it's not a headache. And if we can rebalance the head and neck, often those headaches go away.
I experience pain of 11 out of a scale of 1 to 10, and I'm on the ground rolling around, waiting for the pain to subside. After taking 8 to 10 Aleve, it probably took 15 or 20 minutes. And during that time, if I had an axe, I would probably cut my head off.
Typically what cause headaches is accidents or injuries, and what we'll see is an accident or an injury to the head or neck will actually tear loose the connective tissue of the spine. And how that will present in our office, and we'll look for this, is the head will be tilted to one side, and typically as that tilts, the body will respond down below, and so one shoulder will drop short, and then the whole structure will shift. Actually, the brain will try to rebalance the structure, so you have locking in the joints down the spine, even tightness down in the hips, and all the way throughout the back. And the tension then will really start to build in the upper spine, because that head weighs about as much as a bowling ball. So if it's shifted off balance, it puts a lot of stress on the structures and the nerves as well.
Over the last 20 years, I've tried traditional doctors, neurologists, many medications, and nothing has worked.
Our success rate is about 80%. So when patients come in, we would evaluate them. We'd check their posture. We'd check for muscle imbalances. We'd check the motion. We'd check for heat differences on one side of the spine or the other. And if they have the signs of a misalignment in the upper spine, it's about an 80% success rate that we'll be able to help them and give them that relief that they need.
Several months after starting the treatment with Dr. Besso, I felt a couple days of relief and then more, and now I'm totally headache free, and I can't believe it.
One of the points that's most important to understand is you don't have to live with headaches. You see the advertisements that say, take this for your everyday normal headache. Headaches are not normal, and I would just encourage everyone to look for the cause of their headaches and not just try to cover up the symptoms.
But I'm square now. And I don't have to worry about getting a headache in the middle of a game.
Yeah, actually, and then how you're hitting the softball. You just told me that.
Thanks again. Yeah, 290 instead of 300 over the fence. Just dropping them short, but
That's pretty good, though.
yeah, feel much more energy.